As COVID cases flare, some schools and businesses reinstate mask mandates. A familiar pandemic era safety measure is making a comeback as new COVID-19 variants surface and cases of the disease flare in some parts of the U.S. The number of COVID-19 cases has climbed for several weeks, with health authorities saying they're tracking the spread of three variants. As a result, some businesses and other institutions are again requiring people to wear masks, which have proved an effective tool for slowing the spread of the virus. Like vaccine requirements, cities and states have widely dropped mask mandates as COVID-19 rates have dropped since peaking in 2022. In February, for example, New York State dropped a requirement that face coverings be worn even in healthcare settings, in line with guidance from the Centers of Disease Control and Prevention, after most other local businesses had already nixed mandates voluntarily. Morris Brown College in Atlanta this week announced that the small liberal arts school is reinstating its mask mandate for 2 weeks, citing COVID cases among students. As of Tuesday, the school required that all students and staff members wear masks, according to a statement from college president Dr. Kevin James. The college is also imposing restrictions on event sizes, including parties, and is resuming efforts to trace infections. There will be no parties or large student events on campus for the next 2 weeks, the school said. The college is also asking students who test positive for COVID-19 to isolate for at least 5 days and to attend class virtually while in isolation. The latest CDC data shows that COVID-19 hospitalizations are up 30% across Georgia, driven by the spread of new variants. In California, with cases of the virus rising in Los Angeles, movie studio Lionsgate is reinstating an in-office mask mandate at its Santa Monica headquarters. Deadline first reported Lionsgate said a number of employees had recently tested positive for COVID-19, according to the report. Lionsgate is also reviving other safety measures. All employees are required to perform a self-screening for COVID-19 symptoms daily before reporting to the office, according to the deadline. Employees with symptoms or those who have recently returned from international travel are asked to stay home and notify the company's response manager, the publication reported, citing an internal company email. Lionsgate could not immediately be reached for comment. As of August 12th, 330 Los Angeles County residents were hospitalized with COVID-19, according to the city's Department of Public Health. In Northern California, healthcare company Kaiser Permanente has reintroduced a mask mandate at its Santa Rosa Hospital and medical offices. In response to this latest increase in COVID-19 cases, a spokesperson said in an email to CBS Money Watch, it applies to physicians, staff, patients, members, and visitors. Respiratory protection and the use of masking is an important component in keeping our healthcare workers, physicians, and patients safe, the company added in a statement. Some experts fear it would be hard to convince Americans to put on masks again, even if COVID cases continue to rise. Dr. Danielle Omped, an epidemiologist at the NYU School of Global Public Health, said, "It's a bit like putting the genie back in the bottle." Still, she has personally started wearing a mask again recently in crowded places where the risk of exposure is greater. If I were with people who aren't public health trained, I would wear a mask, particularly in crowded situations, because I really don't have time for COVID. Mask mandates are challenging because they make people really bent out of shape, out of proportion with masks. Dr. Carol Lieberman, a board certified psychiatrist who is also trained in public health, called the return of mask mandates triggering for some people. These new warnings about rising COVID 19 rates are affecting people in different ways. For some, it's triggering renewed fears of getting sick and dying, she told CBS Money Watch. For others, it's fear of being told what to do, from masks to vaccines to lockdowns. We know now the impact of some of these mandates, like kids missing school, loss of businesses, jobs, and money. So we are as fearful of this as we are of COVID 19.